Hey everybody, welcome back. My name is Adam Gorola and I'm here at the Dental Arc and the Stevenson's Dental Arc with Dr. Roberto Loar. How are you?
Doing well, thank you.
Awesome, man. So tell us a little bit about yourself. What does your work entail?
I grew up in Northeast Texas, and actually from El Paso, it would be like a 12-hour drive. So like the way opposite side of Texas. And then I finished dental school. I went to San Antonio. I finished in 2007, and I worked for a while as a general dentist, and then decided I really liked working with kids. So I went back to residency. After working for 5 years as a general dentist, I went back to residency for 2 years, actually down on the border in Laredo, and decided I wanted to be a pediatric dentist. And so we specialize in seeing kids. We say kids, but really we'll see like special needs patients as well, like kind of all ages. But it's definitely been a good choice, and I enjoy it a lot more than.
What was the primary reason for switching from a general dentist over to pediatrics?
So I enjoyed general dentistry, but just whenever I saw kids in the practice, like it was just more natural, and like it just felt better, and people said that I was good with kids. And so then I was like, well, like this is something I really enjoy, so let me pursue it more. Then I wanted to be like the specialist, the person that you would, send people to. So
Now, what is it that you like the most about dealing with kids? Is it the way they interact or the smiles? What is it?
So kids, they're all like different. They're all special. So every day coming to work, you have no idea what you're like gonna get into. But I think the thing like about them all is just they're all inquisitive, and they're all like, once you like kind of talk to them and get to know them, then I guess you can break down these little barriers. So one of the favorite things that I like about pediatric dentistry is having like when we have scared kids come in, kids that have went to another office and they had a bad experience, or they just have never been to the dentist and they're really nervous about it. Because then we can really take the time out and like hear them and listen to them and work them through. And like that's the most rewarding thing, is when someone was like super, super scared and almost traumatized, but then after, having an appointment, then they're relaxed and they let us get the work done and everyone's happy. Those are like the best experiences.
And that's a great testament to you guys here at the Stevenson's Dental Arc and the Dental Arc. My children come here and they feel like part of the family. As soon as they walk in, I don't hear cries. They're not worried. They're excited to get in the dentist chair, and the opposite was true for me. So, all right. So I know you don't like talking about yourself. I know this, but you were nominated and selected as one of the top 40 specialists in the United States. How does that make you feel?
Definitely it was surprising, but it's definitely an honor too. It's very cool. So it was one of the top 40 specialists under 40. So it's a cool thing, and I definitely feel honored about it.
So also you do many volunteer trips a year. About how many do you do a year?
I think for the past 4 years, I've been averaging about 5 international volunteer mission trips.
Why do you find that why do you feel it's so important to go on these trips?
It's definitely it's very rewarding to me, and so that's why I enjoy it. I get out so much from it. But just knowing that out there in the world, there are places that there's not dentists at all, and there's need everywhere. And so it's actually really cool. It's something that I can go anywhere with just a limited amount of supplies. So I've been anywhere as close as in Mexico, all the way into Cambodia. I've been out in forests. I've worked in places where there's no running water, no electricity, out in the middle of jungles and everywhere.
I know this wasn't on the list of questions I gave you, but do you have a story that you could share with us? One that may have impacted you?
So I think kind of on one of my trips out to Ethiopia. So that's, it's kind of a special country for me. It's the country that my mom is from. And so I went there as a kid. And so I kind of saw like how people lived and the poverty there. And I think that always kind of stuck into my mind and made me want to go back after I became a dentist to help out. But we were out in one of these villages that, I mean, they still don't have running water. They just built a well so they can get some water. And there was this old man, so it's not a kid, but it was an old man. And he came to our clinic with a huge, huge swelling. And he hadn't eaten or drank, he said, in about 15 days. He was like on like death's like doorstep.
Wow.
And fortunately, like we had us and we had an oral surgeon there with us, and it all was from a tooth infection. And if we weren't there to help him out, there was no way that he would have any help. And I mean, he wouldn't be with us. So definitely like, you know, like amazing. Like when we go out there, we see people that have had pain for years. Like here, we're so fortunate because we have pain, we go to the dentist. Like there, like they say, yeah, I've had this tooth pain for like 3 years, and toothaches are like the worst pain. So just to be able to give relief to someone is amazing, but then like to save someone's life, like that's just crazy.
You've been at Stevenson's Dental Arc for 3 years. Can you tell me a little bit about what makes this place so special?
Yeah, so it's definitely been a very special place. Whenever I first came, like I didn't know like what to expect. Actually, one of my co-residents I went to school with, Dr. Sue, she works here as well, and so she was the one that told me about it and told me a lot of good things. In dentistry, we kind of like, especially in pediatric dentistry, we have a thing called the dental home. And so we like to say like the kids have a dental home, they have a place to come. So when I first came here, like, I mean, that kind of rings true, like as it just being like a home. Like everyone is super friendly and inviting. Like everyone, the ladies up front, when they welcome everybody, to everyone in the back. And so I felt that immediately when I came here, and so hopefully I contribute to it as well, but so it just feels like a nice home to come to.
Why do you feel parents should bring their children here?
So there's a lot of reasons. I think one of the biggest reasons is everyone here. I mean, of course, like I love to treat kids and I love to try to give everyone a good experience. But it definitely can't just be the doctor. It's like all of the staff. So our assistants are like just on top of their game. Like they're so friendly and inviting, comforting and calming. Our ladies up front, as soon as someone walks in, like they just feel welcome, like they're seeing a friend. And just when I overhear them chatting, it's like, how do you know so much about everybody? And it's just, I mean, it's just a very warm and welcoming environment. Mm-hmm. And so it's just a good place to be.
So what makes the Stevenson's Dental Arc and the Dental Arc different from my grandpa's dentist up the street?
So I think a lot of people don't realize that there is a difference in like a pediatric dentist and a general dentist. And so there are plenty of places to go to the dentist, and a lot of places see kids as well. But here at Stevenson's Dental Arc, where we're pediatric dentists, we are specialized in that. So we have extra training, and our training is in a lot of different things. It's in like patient management, just how to care for kids, and then it's in like the procedures that we do. There's just a lot of different aspects that go into our extra training that make us very prepared to treat children.
Thank you so much, Dr. Loar, for joining us, and thank you for joining us as well. Stick tuned for more information and more highlights.